I wondered if either of you could expand more on where research falls in kind of the injury prevention paradigm.
I see it as more cyclical than anything else, where you have the cycle of research being done, you have an impact, or you find something that will make a difference. It's put into practice, you evaluate the practice, and you modify some of the practices so that it really, you make them stronger, and you really do more with the interventions. I think the other piece of it is the surveillance piece, which is the initial data gathering piece, and picking that up to identify the problems. I think Carolyn pointed out one of the problems that we have with data, and that is that right now we have data from 2007, it's now 2011, so those data are 4 years old. And we haven't really invested in data systems that allow us to collect real-time data, or even data that doesn't lag behind for more than a few years. And I think that's really critical.
And I think the other thing about research is I think we are neglecting to some extent the translational research, so that we know theoretically what works and what works in certain contexts. We may even know what works in a sort of a controlled experimental sort of intervention, but the translation to get it to scale, the translation to get it to sustain, the evaluation research, and then some of the other fundamental research about why do people do what they do, and how do we effectively change communities and environments and policy. That's also critical research. So there's research that, there's the continuum of basic to applied to translation to outcomes evaluation. But then there's also the cycles of evaluation and the cycles of research, looking from at the person, at the beginning of who's involved, right out to some of the more sort of systems type of research that needs to be done.
Just add to that the difference between public health research and sort of the bench research, and why it's different.
Sure. Well, I think some of the the bench research is basically what takes place inside the laboratory, and is not necessarily identifying what's going on with people. It may be looking at a cell, it may be looking at what's happening within that cell, and it may take it quite a long time before that gets translated. So it's either at the bedside or sometimes out in the community. I think the kind of research that we're talking about with respect to injury is the research that starts with the surveillance that identifies the problem and then says, okay, now we have to figure out how to deal with that problem in the community setting. It's not in a laboratory setting so much, but in a setting where it's in the real world, and we're figuring out how the interventions can work in the real world with the resources that we have out there. Because I think the other challenges with research is often people will do research, they'll do a trial, they'll implement a program, and then once the research is done, the program is gone, no matter how successful it was.
Mm-hmm.
We really need to be able to take something, bring it forward, be able to use resources that we have, and not increase costs so much that it's just prohibitive to implement the intervention.
I think the other thing about public health research is that we work in a very uncontrolled environment, so that often in lab or bench science you're able to control so much of what goes on in the environment. And I think the challenge for public health research is at two levels. At one level, you need to have it be contextually specific enough that it's meaningful in this particular environment. But then you've got to do the work to figure out, well, then how do I take it from this context and move it to a different context? So there's a lot of tailoring kind of research that needs to happen in public health.